Estás viendo Canal América, televisión dominicana para el mundo.
A Time for Truth show is sponsored by the Office of Dr. Bernard Fialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to A Time for Truth show. I'm your host, Dr. Bernard Fialkoff, and it's a pleasure to have you back with us again today. And today we have a show very interesting because it involves some things that causes fear, but we're going to give solutions, and we're going to give information that you need so that you can confront wisdom teeth and how to take care of them, and really so much information that's important regarding this subject that so many of us are ourselves, or if we're older, our kids, have so many questions about. And tonight, if we put some of his pictures up on the screen, engineer, we're going to introduce Dr. Juan Carlos De Fex, a maxillofacial surgeon, there you see him, of Queens, New York, who graduated from Javeriana University Dental School in Bogota, Colombia, in 1985, and New York University College of Dentistry in 1990. Dr. De Fex subsequently pursued his general practice residency training at Mount Sinai Medical Center and Wyckoff Heights Medical Center. He completed his oral maxillofacial surgery fellowship at Woodhull Hospital and his oral and maxillofacial surgery specialty at Lincoln Hospital and Nassau University Medical Center. He is a member of the American Association of Oral Maxillofacial Surgeons and the New York State Organization of Maxillofacial Surgeons. He was president of the Spanish American Medical and Dental Society and is an active attending at Long Island Jewish Medical Center and Nassau University Medical Center Department of Dentistry. Dr. De Fex has a private practice with emphasis in IV sedation, dental alveolar surgery, bone reconstruction, and implants in Queens, New York. He is also president of the Rotary Club of Jackson Heights, helping his community. There you see his office, Dr. Juan Carlos De Fex. And Buddha, if you will, let's bring him up on the screen and bid a warm welcome, Dr. Carlos De Fex, to A Time for Truth show.
Hi, how you doing? Thank you for the invitation.
Oh, it's a pleasure to have you. How are you doing?
I'm doing excellent. I'm doing very good. It's the first day of the week. It's Monday. But I like Mondays because Mondays is good because when the morning is done, then it's almost Friday. That's it.
I like the way you're thinking. Then the weekend comes and we can hang out.
Exactly. You and I will hang out. So how is it going? How was your day?
Oh, you know what? We had a very nice day at the office, and here all of our viewers are going to get a chance to see that dentists are real people, and that we're nice people. And you know, but I want to get to you. I had a great day, but I want to ask you something because I know you have a lot to relay to people, and you've done really well in your life. So let's start out when you were a young guy. What were your dreams when you were a youngster?
That's an excellent question. And I was thinking about that yesterday because I don't know. I had an intuition. I thought you were going to ask me that question. So I thought about it. But first, like every kid in my country, I'm from Colombia, you want to be a policeman and you want to be a firefighter. That's what you want to be. I don't know why. Don't ask me why. But then when I went into high school, I was changing my mind. I was thinking I want to be now a medical doctor. Why? Because my grandfather was a medical doctor. 2 years later, I changed my mind again. Now I want to be a dentist. Why? Because my mother was a dentist. Well, she's a dentist. She's still alive. She doesn't practice. So then I spoke to my parents, said, I want to be a dentist. They were so happy. And now I'm going to Bogota, which is the capital of Colombia. And I completed there my dentistry in 1985. A few years ago. Yeah.
It's unbelievable how time flies by, no?
I understand. Yeah, it's unbelievable. But the good thing is interesting. I came to the United States because I wanted to be an oral maxillofacial surgeon and then go back. I'm here now, 30 something years. Well, that was a dream. I was dreaming of coming back, but it never happened like that. I'm not complaining. I'm still happy.
Well, you know what? New York is lucky to have you, a warm, kind-hearted oral maxillofacial surgeon. That's a great combination. And, you know, you kind of answered my next question because I was curious how you decided to enter the dental field, but I see that your family was always in the health professions. Really, it's funny. It's like mine because my father was a physician and he was trained in Cuba, and my mother was a pharmacist. So for me, I always thought of going into something in the health field. And then as time went on, you know, I realized, okay, it's going to be dentistry. And so lo and behold, here we are, two dentists on this show. And then, so now, what was it, because you went into the dental field, but then why is it that you said, okay, I'm going to become an oral maxillofacial surgeon? What was it that you looked at that inspired you?
That was another thing on my last year of dental school. When we went to surgery clinic, I loved it so much, and I was really impressed. How could I do it? Because to be a surgeon, to be a dentist in general, you have to have hands, you have to have ability, and I think I had it. And my instructors were telling me, like, you have a lot of ability. You should think about doing oral surgery, right? But then I got a little frustrated because I couldn't, because I was my first time taking out teeth, and I couldn't do it so well, you know. But I kept going, and the one thing that caught my attention is that we was helping people because they were coming in pain. So you couldn't do anything else but remove the tooth, and then people, you could see their faces. Just the minute you inject them, the minute you give them local anesthesia, their faces change 100%. Now they're happy people. And once you remove the tooth, you take them out of, you make them disease free. You make them happy. Now they could talk. Now they could, go with friends. Now they could go out. Now they could eat. All those things called my attention. So I think I could help a lot of people by doing what I'm doing now.
Very interesting. That makes a lot of sense. And I think it's something that we should share with the viewers is, as dentists, what we're really trying to do is get people out of pain. And unfortunately, they come in with pain and we have to give them the Novocaine, but even the Novocaine now we give a little bit of jelly, so the topical Novocaine, and really we want to help them. And so I think what's important, I wanted to ask you so the viewers can get an idea. So what type of treatment do you provide patients as an oral maxillofacial surgeon?
You could have, while you're being trained, you could, decide what exactly you want to do. We do a lot of training in the hospitals. We do trauma. We do a lot of jaw fractures, cheekbone fractures, eye socket ball fractures. We do, of course, extraction of wisdom teeth, extraction of regular teeth. We do implant. We do bone reconstruction. Some people will even go into a fellowship. Some oral surgeons will go into fellowship and they even do cosmetic surgery. You could do eyelid surgery, nose surgery. And some of the guys like to work with cancer patients. So here you go, they go for head and neck cancer. So it's a variety of things that we could do. Plus, we also train as an anesthesiologist. So we could actually put people to sleep in our offices, which makes it easier for them. So much easier for them because they come nervous. And it's really a nice way to treat the patients. When they come to your office, you could offer them sedation. They go to sleep and then you could treat them in a nice way. They feel pretty comfortable. And they really like it. Okay. Nowadays, I think that things are changing a little bit, but we still go to the basics. And the other thing that we could treat also is infections. Patients get infected. For some reason, they get infections from the teeth, and then they get, swollen faces. We do manage that pretty well in the hospitals. And we have a good relation with all the different specialties in our hospitals, like plastic surgeons, ENTs, anesthesiologists, everybody in the hospital. Basically, we share a lot of information with them. So there you go. We do, after dental school, we do either 4 or 6 years. It depends what you want to do. If you want to be an MD, you want to have dual degree, MD and DDS, then you go 6 years in the hospitals. And if you want to be a DDS with the Oral Maxillofacial Surgery title, you do 4 years. But it doesn't stop there. Once you finish your training in a hospital, then you have to take the examinations of the board, because we have what we call the ABOMS, which is the American Board of Oral Maxillofacial Surgeons, in which they test you. You have to do a written test, and you have to pass it, of course. And then you have to do an oral test. And then, of course, you have to pass it. But now things don't stop there. Now we're doing recertifications. We do recertifications every 10 years. As many of the other specialties, I think, like family practice or psychiatrists, they do it every 5, I think. But we do it every 10 years. So this is going to be, my second recertification is going to be in 2026. Things have changed. Yeah. And then they changed the scheme a little bit. Now what we're doing is every year we're doing a little bit. Let's say last year I had to do reading. I had to read 5 articles and then, get 100% of my answers. And that way I'm trying to achieve my next certification every year until 2026. So it becomes very intense. We have to study a lot, all right? And that teaches you a lot too. I mean, you also know what are you able to do, and also why not. What are you not able to do? Because that's important when you do this profession. And always look for help. That's the way I think, and that's the way we should practice. We should practice. We should treat the patients like our own family. like our own son, like my own father, like my good friends. That's the way I think we should practice, and that's the way I want to practice, and that's the way I practice.
Well, you know what? It's a very sound philosophy, and I got to tell you that, I'm sure your patients really are very happy with you, because as I sit here listening to you, I'm getting very relaxed, and I'm enjoying the show. I'm letting you take the show and just go forward with it. And so I'm sure your patients probably do the same thing. They come in and they put their mouths in your hands and they walk out happy, and the problem is gone. So I congratulate you on your bedside manner.
Oh, thank you. Thank you. Very interesting. And yeah, that's how you make them happy. I mean, you help them too. And on top of that, they go home very happy. And they do
Absolutely.
good.
I was going to ask you a question, because I know it's something we promised the people. So what do you feel that people should know regarding wisdom teeth?
Wisdom teeth are, well, the back molars are the back molars, all the way in the back. We have different reasons. The main reason I remove wisdom teeth, I would say like 80% of those is because they cause pain. We were talking about that before when we started the show. And I think that now, on even early, even when they are 16 or 17, when they're just coming out, they could give you pain, but that pain is not as intense as when they become 18, 19 years old, because it really gets infected. It gets swollen. And then you cannot eat properly, cannot go to school, you cannot do any work. So they really need a lot of attention. They need an emergency treatment for those wisdom teeth. Now, most of the wisdom teeth that I remove or that I do surgery on is because of pain. But you have the other side. You have the wisdom teeth that you don't even know they are there. What do you do in that case? Well, when you go to the general dentist, they might do an x-ray, but what happens when they do the x-ray, sometimes they do these small x-rays, they cannot see the whole tooth. But there is a recommendation for you guys. You should have your wisdom teeth checked, even though there is no pain, because sometimes these wisdom teeth, you could have cysts or tumors developing around the tooth. It's not that common. It's less than 2%, but in any case, they should be checking. They should be checked. It's like doing like any other, like if you went to your medical doctor, you went to your cardiologist to check your heart, I think we should go ahead and start promoting that young people will start checking wisdom teeth as a young age, maybe at 16, 17 years old.
Very nice. Well, we have a video on third molars, and so let's play that at this point so that the viewers can get a little more visual on what you were talking about. And engineer, if you could please, let's put on that video on the third molar.
Wisdom teeth, or third molars, usually enter the mouth between the ages of 17 and 25, a time of life that has been called the age of wisdom. When a tooth is blocked by another tooth, or grows in a manner that makes it impossible to enter the mouth normally, it is said to be impacted. Many people have one or more impacted wisdom teeth. This video explains how third molar surgery can help prevent later problems in your mouth and teeth.
If wisdom teeth are to be extracted, we like to remove them when patients are younger, late teens or early 20s, because it's an easier surgery for patients. The bone is more forgiving, the teeth aren't fully formed, and we don't have to worry about the roots being close to important structures like the nerves in the lower jaw and the sinuses in the upper jaw.
You know, the problem with third molars is that they often do not have enough space to grow into the mouth. For some patients, the teeth do come in, but are so difficult to keep clean that it's better to remove them so that they do not develop problems that affect the teeth in front of the third molars. Sometimes these teeth are stuck or impacted underneath the gums. That gives them the potential to develop cysts and cause other problems later in life. Because the likelihood that impacted third molars can cause problems now or problems in the future, they are generally recommended for removal when a person reaches the late teens or early 20s.
Many orthodontists refer their patients to an oral surgeon for wisdom tooth extraction to alleviate hygiene challenges and minimize the possibility of gum disease, cavities, and other problems that could affect the success of orthodontic treatment.
If your orthodontist recommends extraction, you'll meet with the Oral and Maxillofacial Surgeon beforehand. The surgeon will evaluate your particular situation and may perform certain diagnostic tests. For surgery, it's very important that the mouth be clean. We ask patients to brush and floss their teeth as usual. Wisdom teeth are usually removed under general sedation, although sometimes only local anesthesia is used. Patients who will receive an intravenous anesthesia should not eat or drink for 6 hours before surgery. Finally, it's best to go to surgery wearing loose and comfortable clothing.
The oral and maxillofacial surgeon selects the method that is best for each patient. The length and complexity of third molar surgery depends on a number of factors. It includes the position of the tooth, the length and curvature of the roots, the thickness of the bone surrounding the teeth, and the patient's overall physical condition and health. In general, a young adult's wisdom teeth have incomplete root systems, making tooth removal relatively uncomplicated. As wisdom teeth continue to grow, their roots lengthen and may become tangled with the sensory nerves that run through the lower jaw. When that happens, surgery is more difficult and complications are more likely. If the tooth is impacted, an incision is made in the gum tissue, which is turned back so the tooth can be seen. If bone is covering the tooth, some of it may need to be removed in order to expose the tooth. This tooth may be removed in one piece, or in some cases, it may be cut into sections. The removal of 4 impacted wisdom teeth usually takes 45 to 60 minutes to complete. Once the wisdom teeth are removed, the gum tissue is sutured. Following surgery, patients rest under supervision in the oral surgery office until they are ready to be taken home. Before leaving for home, patients are given specific post-surgical instructions and prescriptions, including pain medication.
The best outcome is the ability of patients to be able to properly maintain the rest of the teeth they're keeping. Long term, patients can expect to experience improved dental hygiene and ease of home care.
For more information about third molar surgery, contact your orthodontist or your oral and maxillofacial surgeon.
So that kind of went over visually what you were talking about. And let me ask you a question then. So why do you feel it's important? Because I know there are a lot of general dentists sometimes that do a lot of different parts of dentistry, and sometimes it's okay, but I think if I was going to get a third molar out, I'd go to a wisdom, to an oral surgeon. So why do you feel it's a good idea for a patient to seek out an oral surgeon for wisdom teeth?
Because, well, first we had way more training. We have 4 years of hospital training, and we do thousands of wisdom teeth or hundreds of wisdom teeth before we graduate from this specialty. Number one. And this is what we do every day. This is what I do all day long. I remove wisdom teeth, or I don't remove wisdom teeth. Sometimes I tell them I cannot do it because there might be some risk. There might be some complications. There might be some bleeding. You have a nerve. The video showed there was a nerve pretty close. So sometimes the tooth is so close to the nerve, you cannot even do it. There are other options too. But basically, we have more experience because we do more. we do more of those wisdom teeth. And that's related to the factor of the complications. The more you do, the less complications you're going to be able to produce to your patients. So I think that's one of the main reasons why patients should be looking for an oral maxillofacial surgeon to do third molar or wisdom teeth extraction, especially because some wisdom teeth are pretty deep in the jaw, as the video was showing. Sometimes they're deep in the jaw, you have to open up the gums, and then you have to look for the tooth, and then you have to cut the tooth in different sections. Maybe sometimes you have to take out the tooth in 2, 3, 4, 6, a lot of pieces. Okay, and that requires, that you know the anatomy, number one, and number two, that you have a lot of experience doing this wisdom teeth, and also that you are aware of all these anatomical structures that might be close to the wisdom tooth, as the video was telling. The other thing that we could do for the patients, as I mentioned before, and the video also said that we could do sedation. We're training anesthesia. We're trained a license. We have a license by the State Education Department to provide general anesthesia to our patients in our offices. She makes the procedure very, very easy for them. Very easy for them. So all those reasons that I mentioned before is that I want to tell our public that is listening to us that they should be looking for oral maxillofacial surgeons to treat, to evaluate, and to remove your third molars, especially when you have situations where you are in pain already or your gums are swollen. Sometimes you cannot even open the mouth because you're having a lot of swelling in the back of your mouth. But we can do it. We know how to do that.
Absolutely. That's a very complete and honest answer. And I think it explains everything that the viewer needs to know. I want to ask you something because there are many times I see it in my own practice, people who come in and their teeth are misaligned, or they don't like that they show too much. Their teeth are just, the bone looks like it's way down, and the bone looks like very large, and so the front teeth are way down, and they're very uncomfortable cosmetically, or maybe they want to do some orthodontics, but the orthodontic says to them that they can't just do it with orthodontics. So I want to ask you to describe a little bit to the patients about what the oral surgeon like you know who you are, can do with what's called orthodontic surgery.
Yeah, that's another interesting topic, especially when patients show too much. The main complaint here is that they show too much gum when they smile. So they have this area of the face too long. So now you want to fix it. You want to make it look better. You want to make it look nice. You want to correct the amount of gum that this person is showing when they smile. Or sometimes they have a jaw that is too long, so you want to make it shorter. So those things combine with braces, of course, because you need braces too in order to complete a successful orthodontic surgery. You do this process in the hospitals, and the way you do it is everything is done inside the mouth. Everything is done inside the mouth. You don't have any scars on your face. And the way you do it is you use these special drills, very fine saws. And what you do is you cut the bone. You cut the bone at specific areas that you already know, because that areas are the one that causes less bleeding. There are not important anatomical structures that you may damage. So then after that, you just put them together. You cut the bone from the jaw on the top, and you cut the bone on the lower jaw, you cut the bone in the back, and then now you make it loose. And you put the teeth together, and nowadays you use small plates and screws to fixate the joint where you want to put it back. Now, braces will help a lot also because sometimes these patients need to be wired. The teeth need to be wired for another 2 3 weeks to wait for bone to heal. These procedures are done under general anesthesia. It might take about 4 to 6 hours to complete one of these procedures, but be aware of this. Look, we don't do it. We are a team. We always work as a team. So in the operating room, you'll see the senior surgeon. Okay? Senior surgeon is a person who's got a lot of experience and is always there with you. Okay? And you see from the senior surgeon to a resident, and everybody is helping. So we do this we use a team. We are like usually we're like 2, 3, or 4 people trying to doing this surgery for the best success and the best outcome for the patients. Now after that, of course, you're going to have some swelling and a little bit of discomfort, but the actual now you're going to look much better after these kind of surgeries.
Very nice. Well, you know what? That's something important for those of you out there who don't like the way you look and you thought that there was nothing you can do. You could actually see Dr. De Fex. And you know, we've had such a good talk here that we've run totally out of time. And I want just to ask you in very short, like maybe 15, 20 seconds, what concluding statement would you like to give?
Okay, thank you. Yeah, I want to say to the viewers, listen, the oral health is very important, okay? Because that's how they look at you. So first of all, I want to tell you, try to keep your teeth in good health. That's number one. As an oral surgeon, I want you to do that. And if you have any surgery related issues in your mouth, please look for an oral surgeon. We are specialists and we know exactly how to manage these cases much better than, because we have a specific training in all the anomalies and problems of the mouth and face.
Well, you know, Juan Carlos De Fex, thank you for being on the show.
Oh, thank you for your invitation. It was nice. I like these shows. I like to be on TV.
Well, you know what? We'll have you back on again next time, another topic. Unfortunately, we ran out of time. We had too good a time. I hope this has helped the viewers as you've been watching. And we'll see you again on the next episode of A Time for Truth show. Be well.
This show was sponsored by A Time for Truth Foundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your feet